I'm here with the Brazilian Medical Genetics Society Zika Virus Embriopathy Task Team, and they have an outreach clinic here at the Zika Eye Hospital, where we're looking at babies essentially, most of them under a year of age, who have been brought in for diagnosis to see if they have the Zika virus embriopathy. What we're going to do is go inside just now and see the clinic, but it's probably important to note that yesterday when we were here, we saw some 36 children who were diagnosed as having this embriopathy. And that's just an indication of the potential immensity of this problem in Brazil, but given that it's spreading north and south in South America, one has to consider that this is going to be a major epidemic problem going forward. And it is the Brazilian Medical Genetics Society's aim in this project to try and understand what is driving this project, to try and understand the clinical features or the phenotype of the children with this, and to try and find ways, first of all, to help the mothers and the individual children, or the mothers and the fathers and the individual children, but also to find ways of trying to stem this epidemic. We're going to go into the clinic now. Sitting outside are two gentlemen who volunteer at this clinic, which is a non-governmental organization. We're inside the reception of the Zika Eye Hospital, and with us here is Dr. Islani, who founded this clinic to help children with ophthalmological problems. How do you feel about having this team of people coming to help you with the Zika virus problem you have here?
Eu me sinto muito privilegiada em ter a oportunidade de estar aqui contribuindo na prevenção da cegueira por retinopatia da prematuridade, catarata congênita e outras doenças como glaucoma também. A epidemia de Zika aqui no Brasil fez a gente abraçar essa causa para dar oportunidade de integração entre as equipes de neurologia, de neuropediatria, de pediatria, da genética e da oftalmologia, para que a gente possa estar dando uma alavanca de informações importantes para o Brasil e para o mundo, para que haja vacina, para que haja prevenção contra essa doença que causa tanta destruição no sistema nervoso central.
Esse é o Dr. Arnold, geneticista da África do Sul, e ele veio fazer algumas perguntas para vocês.
Can you please ask them where they've come from today to be here and why are they here?
Dr. Arnold quer saber de onde é que vocês são e por que vocês estão aqui hoje.
Estamos aqui de Fortaleza mesmo. Nós estamos aqui porque a criança nasceu com microcefalia. E a gente veio para fazer essa avaliação.
Okay, they're here because their kid was born with microcephaly and they want to get the kid examined by the doctors.
So they want to find out if their child has the Zika virus problem.
Yes, that's it.
That's right. How old is their baby now?
Quantos meses tem bebê agora? 3 months.
3 months. And how has it been with him growing up in the last 3 months? Has it been difficult?
Tem sido difícil nesses últimos 3 meses com ele, o crescimento, notou alguma diferença?
Sim, o que tem sido difícil é organizar os meios para procurar o tratamento, né? Assim, a gente fica por um lado, por outro, procurando, assim, embaixo. Mas o convívio com ele, pessoa não, assim, é uma criança aparentemente normal.
The hardest thing is to find out when or where they're gonna get the doctor's exams, and this is the hardest thing.
The first thing I would like you to take note of is that cry. Many of these babies cry like this and cry like this incessantly. It's a neurological cry. They're very, very difficult to settle, and this is one of the big problems that the parents have to cope with. Sophia is obviously microcephalic, and if you look at the face, she has the bulbous nose, which is commonly seen, swelling edema on the upper eyelids. She has a thin fulcrum, a very small frenulum. Some of the babies actually have no frenulum under the tongue. She has a typical sloping forehead. What you can't feel here, which you sometimes see, is overlapping of the sutures. And what is not as prominent is sometimes you see the temporal bones jutting out, or a temporal bone prominence, which you can't see here. Large rolls of fat on the back of the head, and this loose skin that is seen on the back of the skull. Quite obvious, and sometimes it's even more obvious than that. She has a whorl which is just off the center of the midline, and these babies often have hair pattern abnormalities, this being one of them. What I didn't talk to you about just now was the long eyelashes, which she has, and many of these children have as well. When I first saw her and she wasn't crying, she was in the position of an atonic neck reflex, and we see in many of these babies the persistence of the neonatal reflexes quite late on. Again, just looking at her, please look at the narrowing, the bifrontal narrowing, which is not as marked on her as it is in some of the other babies that we see. Coming down the body, she's very stiff. And this is a common feature that we see amongst these babies from early on, quite marked stiffness. Sometimes her limitation of movement of the lower limbs is not as bad, and she's not as stiff as other babies, but markedly her reflexes at the knee, quite marked. And if you can see that, and we see that in other babies as well. In fact, even more marked in other babies, that they're hyperreflexic. So they're hypertonic and hyperreflexic from early on in life. Visceromegaly is not an issue that we see often in the babies. Coming to their hands, they often have thumbs which adduct, even more so than Sophia's. But there you can see her thumb adducting, quite deep creases, and we sometimes see single palmar creases. She doesn't have camptodactyly. About a small percentage, I think probably 6-7% of these children have evidence of arthrogryphosis. And as we turn her over, one of the interesting things which you're seeing now is these babies like to be on their stomachs, and they tend to settle more easily on their stomachs. You can see, of course, the excess skin there, quite a short neck. As you can see, the arms stiffly out, and that's a common position that we often see the babies in. As we go down, I'm sure she'll start crying again. Taking the ATNR position, very, very stiff in the upper arms. Hyperreflexia there. Difficult to get her hyperreflexia there. Some of the babies, and she's just showing it to a small extent, have a tremor of the arms, of the hands and arms. It's not as marked on Sophia as in other babies. A lot of these babies have dimples either on their elbows, their knees, or on their shoulders. But there are a few other features that we need to remember. One is they very often have a flat top of the skull, which is seen better on 3D constructions of the skull. If you look and feel at the back of the head, the occiput is often very prominent and beaked, which is an issue. And quite diagnostic, especially when one looks at x-rays of the skull. Sophia has got a little nevus flammus on her nose, which is seen in some of these children. Other features that these children have, which were a little bit difficult to see on Sophia, were alveolar hypertrophia, which is sometimes seen, and she doesn't have the other feature quite commonly seen, which is fetal pads on her fingertips, and you can also see them on the toe. I'm with Dr. André Pessoa, a young Brazilian pediatric neurologist who's working on the Zika Virus task team, and he's going to take us through the neurological examination of young Melissa here. Melissa's mother, Deborah, has very kindly offered to allow us to film her baby while Dr. André shows us the features of Melissa.
You can see the examination hypertonia, mainly in the upper limbs. It's a pattern that you are seeing in our patients. The worst of the hypertonia in the most cases are in the upper limbs more than our limbs. And she is doing a tonic cervical reflex, spontaneous tonic cervical reflex. Let's test the tonus in the upper limbs. There's a hypertonia. You can't perform this maneuver. Yes. Testing the tonus and strength in lower limbs. It has a good mobilization of the hips, knees, ankles.
Does the tone in the lower limbs increase as they get older?
Yes, it's possible. It's possible.
Some of the babies have tremor. She doesn't. How often do you see tremor?
It's quite common. I think that's about 95% show the tremors in the extremities.
Right.
Okay? The patient has signs in the upper limbs of that mix pyramidal signs and pyramidal signs. Probably she will evaluate with a dystonia because it has sometimes extension hypertonia and sometimes a flexion hypertonia. These signs are very common in pyramidal.
So this mixed pattern of spasticity and dyskinesia is quite common, is it?
Yes, quite common. Okay, this is a CT of the patient Melissa, and you can see a atrophy, a cortical and a subcortical atrophy with ventricular dilatation ex vacuum, not hypertensive. Okay, and you can see calcification. Subcortical, maybe cortical, but mainly subcortical calcification and mainly frontal calcification, anterior calcification. So in this case you can see the most striking findings in Zika congenital, the atrophy, the cortical and subcortical atrophy, the calcifications, that in this case is pericortical and frontal. You didn't find here the basal ganglia calcification, but it's a common finding too. And the third one, probably it's the polymicrogyria, perisylvian polymicrogyria.
She is discussing with her colleagues one of the babies seen today, And the question is, does the baby have Zika virus retinopathy, or is this rather toxoplasmosis retinopathy? Obviously, making the correct diagnosis is very important. The decision is to do a lumbar puncture and look at the serology and the CSF to try and differentiate whether this is Zika virus embryopathie or not. We're now with Dr. Islani again, who's going to see a new patient and evaluate it from an ophthalmological point of view from the beginning.
I saw the distância intercanthal.
Intercanthal distance narrowed,
Yes.
right? And that's the other problem that you find.
Ocular movements are normal, and strabism, I asked you to come back
Right.
another day to complete the exam and to do the follow-up.
This is the end of the second day of the Brazilian Genetic Society Zika Virus Embryopathy Task Team outreach to Fortaleza to look at the problems out here and to try and diagnose and confirm the patients that were invited to the Cavivia Ophthalmological Hospital over the last 2 days. We're in the region of 90 patients were invited, many of them having to come from long distances away. Only 63 patients were seen, but of those 63 patients, 59 had Zika virus embryopathy confirmed. For me, that's very worrying. I know that a couple of months ago at Recife, another city close by, 200 patients were diagnosed with Zika virus embryopathy. So that's 260 patients in the last couple of months in 2 cities. How big is this problem in Brazil? And at least Brazil is trying to get a handle on how big it is. In fact, how big is it in the countries surrounding Brazil to the north and the south? And the point of asking this question is very simply, if we have 260 patients diagnosed in 2 cities in Brazil with this embryopathy, all of whom are under 11 months of age, and all of whom, as they grow up, are going to be severely disabled, requiring care continually from their parents, care from the health service, and many of them will die young. What's the effect of this epidemic, as it would now seem to be, going to be, first of all, on the parents of these young children? Secondly, for the healthcare system, because the healthcare system is going to have to look after these children. And secondly, for society in general, and thirdly, I should say, for society in general, because this is going to cost a lot of money. It's a major problem for Brazil. I just hope that countries around understand and accept this and start doing the work to find out how big the problem is there, and to start putting in place systems for care for the children and their parents. And as I discussed with my colleagues yesterday, it came from Polynesia, it's in South America. Where to next? Almost certainly Africa must be at risk, and certainly Africa should start thinking about it, and then beyond Africa, back into Asia, where allegedly this strain of the virus came from. This is certainly a very serious problem, a global problem, I think, coming about in the next couple of years. And I'm certain that the Brazilian Medical Genetics Society's work on this problem will give us many of the answers we need to try and overcome the problem.